Welcome back to EmpowerND Podcast. This podcast creates space for honest conversations about health, well-being, and community resources to help people in southwestern North Dakota live healthy, full lives. The EmpowerND Podcast is produced by Women Empowering Women, a nonprofit organization dedicated to connecting, supporting, and educating women to help them become the best versions of themselves. To become a member or learn more, visit wewnetwork.org. Mental health care is about much more than a diagnosis or a prescription. It's about understanding the person, finding the right combination of support, and knowing when it's time to ask for help. Today, we're joined by Tony from Midwest Psychiatric Care to talk about what psychiatric care really looks like beyond medication. We'll talk about treating the whole person, the role of therapy and lifestyle alongside medication, what to expect when seeking care, and why you don't have to wait until you're in crisis to take your mental health seriously. Let's get started. Okay, before we get started, can you tell us a little about yourself, your background, and what you do at Midwest Psychiatric Care?
Yes, I'm Tony Abelseth. I'm a psychiatric and mental health nurse practitioner, and I work at Midwest Psychiatric Care. I also own it. I work alongside another provider, and we treat all ages, 6 and older, typically.
Okay. When people hear the word psychiatry, many immediately think medication. Why has psychiatric care become so closely associated with prescriptions?
I think probably because it's the most visible part of psychiatric care. You can see that prescription at the end of the day. But what you don't often see is what happens behind the closed doors and, the support that's being offered
Right.
in the office.
Okay, so what do you wish people understood about what actually happens in psychiatric care beyond writing a prescription?
Yeah, it's a lot of listening. I'm definitely doing more listening than I am prescribing for sure. Just to understand what's really going on in their lives and what's challenging for them, and hopefully instilling that sense of hope and purpose, and giving them, something to look forward to and to feel better for.
Okay. So mental health is often talked about only when someone is struggling with a diagnosis or crisis. Why is that such a limited view of mental health?
Well, I think that's pretty common where sometimes people might wait until that breaking point before they start to reach out for help. But I like to think of we don't wait until we have a heart attack before we start talking blood pressure
Right.
monitoring and how important movement is for our cardiac health. And I think mental health is the same thing. We should be proactive in promoting our mental health and building resilience.
Right. And I think that in family practice, it's a lot easier to explain that to patients that, we need to do preventative health care. They know that they're supposed to do annual exams every year. And it's not as, I guess people are not as well educated about that process or taught from parents that that's what should happen, that their mental health is something that they have to continually take care of.
Mhm.
And so then it gets left behind.
For
So they
sure.
show up for annual exams, but they're not understanding that their mental health is part of preventative health too.
Mm-hmm.
So, can someone have good mental health while still experiencing stress, anxiety, sadness, or difficult seasons of life?
Totally. I think we were all blessed with these emotions for a reason, right? And so it's good to experience all those in appropriate contexts. But at the same time, when those emotions start to really take a toll, or maybe they're persistent every day and it's starting to affect your life, that's where, getting checked in for mental health support would be really valuable.
So, what are some signs that someone may benefit from support before they reach a breaking point?
I commonly hear, people start to notice feeling irritable a lot,
Mhm.
like maybe with our loved ones a little more than usual, and we're feeling bad about it. Or maybe we're withdrawing from our friends and family more, and not enjoying things as much. Those are usually those better warning signs to look out for.
Yeah, kind of isolating,
Hmm.
not putting themselves in those situations as much where they would have to be social.
Yeah. Or just enjoying less. Like
Right.
maybe their hobbies and interests
Yeah.
don't seem as exciting anymore.
Mhm. So when someone comes to you for help, what are you looking at beyond their symptoms?
Yeah, so symptoms are important, and also the history of how those symptoms maybe have started. But we're also looking at a lot more. We're looking at their day-to-day life, and how are they balancing all the things. We're looking at how are they performing at work, school, home,
Mhm.
how are relationships. We definitely like to explore like childhood and like any history of trauma, even. Those are all important things.
So how do you approach treating the person rather than just treating the diagnosis?
It's very individualized for everyone. Depression for one person can be, staying in bed and just having a hard time doing the day to day. Maybe it's hard to eat, hard to shower, but we can have somebody else with depression and they can still go to work and do their day to day, but maybe they just enjoy things less. Or maybe they're just more tearful behind doors. And so
Mhm.
it really just is case by case dependent. And there's a variety of treatment options we can use to support each individual rather than just treat that
Right.
disorder.
And I think it also is whatever that person is willing to do.
Mm, that's a big
So
one.
even if there's something that you would recommend or you think would help them, if they're not willing to do it,
Hmm.
then you just have to meet them where they're at.
Totally.
So that changes the plan as well. So many people want a clear answer. What will make me feel better? Why is mental health treatment more complicated than that?
I wish there was a one size fits all. Boy, that would be great for a lot of clients.
Mhm.
I think because it's multifaceted. There's a lot of layers to our mental health and what
Right.
supports our mental health, and one person's needs can look a little bit differently from another person's needs. And so
Mhm.
there's just so many layers that we're trying to investigate and figure out how we can support them.
Right. Yeah, I know that like even in my journey with mental health, I know that most people or a lot of people when they're struggling don't want to exercise or move or they become less active
Mm,
where I think I become more active. Like that's what I turn to as a coping mechanism.
sure.
And so it definitely varies between, you know, each individual too. And maybe what their lifetime experiences have been of what does make them feel better.
Yes.
So, what are the different pieces that can support someone's mental health, recovery, or improvement?
Well, a lot of things. I talk about sleep a lot because I think sleep is so valuable. It can make the world of a difference. But between sleep, therapy, it's maybe just connecting with friends and family and having the support, like natural supports at home. It's, finding hobbies and things to enjoy, ways to get out and move.
So, where do medication, therapy, lifestyle changes, and personal support fit into the bigger picture?
Well, they all play a very unique role and they all work together.
Right.
I think of like different tools with different purposes. They
Hmm.
all have a purpose and they can all help in their own unique ways.
There's sometimes fear around psychiatric medication. What are some of the biggest concerns you hear from patients?
Personality changes are a big one. I
Mhm.
hear this a lot like, will this change me as a person or how I think and do things? But that's never the case. I think,
Right.
the goal with medication is to help you feel more like yourself and
Mhm.
function through the day to day more effortlessly.
Right.
So that's one. Another one would be like long-term concerns. Like, do I have to be on this medication
Right.
forever? Will I become dependent on the
Mhm.
medication? And when we're utilizing first line treatment options in treating mental health conditions, we're never picking something that's going to cause like physiological dependence
Right.
or something that would require long term
Mhm.
use. If you have those short term goals with medication, I think that's great because we all go through these seasons of life where
Yeah.
we might need something temporarily and might not need it 6 months down the road.
Yeah, and for some reason, I think there's a lot of guilt around needing it,
Hmm.
and shame, I think, around needing that, whether it be long term or short term.
Hmm.
But the having to use or needing to use medication, for some reason, there's a stigma around that that
Yeah.
prevents people sometimes from even getting help.
Yes. Stigma for sure plays a big
Mhm.
role there, I think.
Yeah. What would you say to someone who feels like needing medication means they have failed?
Mm. I would change the perspective to, if we are prescribed a pair of prescription glasses, as an example, like, do we consider ourselves a failure in those moments? Or if we have to take insulin for diabetes,
Right.
when we look at other organs in our system, do we look at it the same way? And that's where
Yeah.
I think stigma can still kind of paint that picture, maybe.
Right. Yeah. How do you know when medication may be helpful and when another approach may be better?
We're usually gonna start considering medication when like the day to day gets harder, that functional impairment we're looking for. So whether we're starting to struggle at school or work, in our relationships, if our sleep now is really just kind of thrown off and it's impacting and having this domino effect on all the other
Right.
things. That's where medication can play a role, as well as like, if you have coping skills that have previously worked for you and now they just don't seem to have much of an effect, or if you're going to therapy and you're just still kind of feeling stuck, that's a good place where medication can play a role.
Right. Why does finding the right treatment sometimes involve adjustments along the way?
Metabolism plays a huge role here. There's a lot of factors that can play a role with how we metabolize medications, especially, and so it's very normal to expect adjustments. Again, no one size fits all, so someone can start at a starting dose, and that can be a great maintenance dose for them and be really effective. But somebody else might need that higher dosage range, and it
Right.
it doesn't mean that they're doing anything wrong or different. It just simply means their body metabolizes things differently.
Yeah, and I think it's really helpful for patients to know how much their genetics play a role in that too. And with the gene site and different, ability to test those genetics and find out which medications their body will metabolize the best, the science on that has come a long ways to make it to where they don't have to suffer through not having the right medications in to start with.
Yeah, those are
So,
such a great tool to
yeah.
use.
So, what does success in psychiatric care actually look like, especially for those who feel like they need to be happy all the time?
Hmm. I don't know that feeling happy all the time is very realistic.
Right.
Again, we're given all these emotions for a reason. It's very normal to, have stress or unexpected things really
Right.
cause us to have changes in emotions, and that's okay. But again, when it becomes more of that day to day hardship, that's where we might have more concerns with how we're doing mentally.
I think
Um,
I think sometimes it's a cultural thing too, that the expectation is that you should be happy all the time
mm,
and that you shouldn't feel those feelings or be able to work through them. So I think that kind of affects the perception that people have of what should their emotions should be doing.
yeah, I think when you think of when things are going well,
Mhm.
w- or do you feel more present in your day-to-day
Right.
life? Are you, enjoying playing with your kids a little bit
Mhm.
more? Are you out
Yeah.
and about socially?
Right. Yep. How important is patient involvement in deciding what care looks like?
Oh, very important. At the end of the day, treatment isn't created for, or it shouldn't be, it's created with. And that's
Right.
where, we're talking about all sorts of options depending on what's going on and what's recommended, but we're
Mhm.
also allowing that person to make an informed decision about their care.
Right.
What is going to fit better in my lifestyle? What am I willing to commit to?
Right.
What seems realistic to implement in my life right now?
Yeah. And sometimes it's really small changes.
Mhm.
Sometimes it's like take a walk around the block in the
Exactly.
morning or something
Yep.
little that gets them moving and is something that they can actually commit to, because if they can't commit to it, then it's
Mhm.
not going to work.
Yeah.
So, what should someone expect during their first psychiatric appointment?
Well, at Midwest Psychiatric Care, we allot for 90 minutes because there's just a lot of information to cover.
Right.
And, at the end of that visit, we want you to feel heard. But I mean, we're looking at not only symptoms and the history of things, but we want to know about family mental health history.
Mhm.
We want to know about your medical history because a lot of our systems are interconnected and they all
Right.
play a big role here. So we're asking about those social history,
Mhm.
childhood, trauma, stressors in your day-to-day life.
Okay, so what are some things people can do today to be more proactive about their mental health?
Sleep.
Yeah.
Prioritize sleep.
Yeah.
Even 1 more hour
Right.
can make a big difference. Movement.
Mhm.
We lose sight of some of those like foundational things that we
Right.
would otherwise expect to have a big role in more of our physical health, but it
Mhm.
plays such a big role in our mental health too.
Yeah.
And just, yeah, having the support, building on your relationships, feeling hopeful, setting goals.
Mhm. One that I really notice and has become really prevalent in the patients that I treat is diet choices too.
Mm,
The lack of, not having the whole foods and increasing in processed diet and ingredients and stuff really plays a role in their mental health too.
yes.
And just eliminating some of the processed foods in their diet can make a huge difference too.
Yeah, I think they play a big role in like inflammation in our
Mhm.
bodies.
Yeah. So what is one thing you wish everyone knew about caring for their mental health?
I wish that they knew they don't have to wait until that breaking point to reach out for support and ask for help.
Right.
Um, at the end of the day, we want you to leave our office feeling heard and understood. And there's a lot of times after that first visit, I'm hearing, like, wow, it feels really good to know that I'm not alone in this.
Right. If someone is listening has been thinking, maybe I should talk to someone, what would you want them to hear?
I would say, I hope you do. Make that first step. It's
Yeah.
the hardest, but it'll be worth it.
If someone listening wants to learn more about Midwest psychiatric care or schedule an appointment, how can they get in touch with you?
They can give us a call. They can find us online. They can send us a message through our website. We have a secure platform we use if you text in as well. So there's lots of options to reach out.
Okay, so thank you for joining us today. Really appreciate you taking the time to talk with us and share more about mental health and psychiatric care. If you're listening and have been wondering whether it might be time to reach out for some support, we hope this conversation gave you a place to start. Until next time, stay informed, stay empowered, and we'll see you on the next EmpowerND podcast.